people go home the same day from having this surgery. I mean, I let people golf at 6 weeks. This was not heard of just 10 years ago.
3 years ago, I had the normal partial knee replacement on my right knee. This surgery was just 3 weeks ago, and I'm already progressing faster with Dr. Lykins using the NAVIO robotic system.
It just allows us to be better. When I first started back in the 80s and 90s, the life expectancy of a total joint was 10 years. Now we're putting in implants that last 20 to 30 years. The NAVIO allows us to be more precise, and if we're more precise, then that's just going to allow better wear and more longevity out of that implant.
When thinking about robotic surgery, we began this quest about a year ago to find the right program to use here at our center. I've been doing computer-assisted knee replacements for over 10 years, and it was an easy transition to go from computer-assisted to robotic. The robotic system is more precise than I can do by myself with just my hands and typical traditional instruments. It's just another tool that we have at our disposal to do a better job for our patients.
Just last weekend, I played some tennis, and it's been a year since my surgery, so I played some tennis and I didn't have any pain, and it was really nice to get out and get back to doing some exercise. I would absolutely recommend Dr. Dulik. The staff, the facility, and Dr. Dulik are professional, and they just made me feel so comfortable about my surgery and my aftercare.
Partial knee replacements kind of have a bad name because a lot of different people have done them and they're tough to put in. And you really have to have skill in carpentry. And what the NAVIO system does is it gives us that extra eye to really allow us to see the entire knee and to actually see how the knee is actually moving. It's allowed us to actually map out the entire knee, or in the case of a partial knee replacement, the affected part of the knee, to be able to give us exact measurements so we can fit the knee as best possible. And then once we've put the knee with the best possible fit, that allows us then to make sure that we have it balanced properly. For knee replacements, the balance of the ligaments dictate the wear pattern that the prosthesis is going to have, and then we actually are just resurfacing it.
When I came to see Dr. Conlan, one of the things I liked about him was the educational process, that they have class and you're well informed about all of your options and how the procedure would be done. One of the complaints that I have heard from people that have had knee replacement is the fact that the knee isn't always exactly where it should be, or something just doesn't always align properly. So I felt confident when he told me about the system and about how he preferred to use that, and that the accuracy rate was very high and the satisfaction rate was very high using the NAVIO system.
Having worked in hospitals and that, having a procedure done as an outpatient was probably a little bit faster. Recovery, I think, was faster. I could go at my own pace, a little more accelerated. The whole experience really came off very, very well, and I have a very good result. It's almost a year later now. I have total function of the knee without any limitations at all, and have no pain, minimal stiffness, and really recovered very well. I really appreciate the knee. I really appreciate the function that I have. You return, at least one knee back to its perfect condition, and the other knee needs to be done and will be done at some time in the future. The procedure went so well, I'm willing to do the second one.
I have had zero pain. Now, I've had a little bit of soreness, but I think that comes from me pushing myself and things that I've not been able to do for a long time. I cannot say enough from the procedure. I would do it all over again, and probably sooner than I did it. I have my life back. I can go and do everything that you promised that I was going to be able to do, and I thank you for that.